So over the past several months, I think they've been working on developing a document which is called the Shared Plan of Care. It does make sense to develop such a document, because what it does, it puts in front of any provider, not necessarily just the primary care provider, it puts in front of the specialists, the support staff, the educators, the healthcare workers, a concrete document that they can refer to and add to. It becomes a living document that comes back to the primary care provider, who can then see where the care is lacking, if at all, and then plugs in that particular need for that patient. So we used to do that. It's not that we don't do that at this moment of time. We do that, but it takes more time now. What we do is, when the patient comes into my pediatric office, I have to actually go and look for the previous notes from the neurologist, and find that, he hasn't seen the neurologist in 6 months. Now the shared pair of care will have features that will, or does have features. I think Patty Passmore, our care coordinator, has actually developed a plan where it has a spot where the next appointment is available for us to view. When is he seeing the neurologist? When is this particular child going to see the developmental specialist? When is he seeing the psychiatrist? We have a timeline, a time frame, a path for the child's future in getting to a better place regarding his health. What it does also, it helps the other specialists to look at whether this particular child was seen by the pediatrician. When was that last visit? What the growth chart even looked like? It's possible to get on there. What is the progress that has been made? Whether the child is immunized or not, so that there's no duplication of services sort of in this. And what it helps the mother do is, or the parent do, is to look at it and see, this is where my child was 6 months back, and look where my child has come in 6 months. That's the pathway to progress in healthcare. And I think it takes away from working in silos and being more collaborative across all spectrums of healthcare.